Hi, everyone. I am here to share with you what pelvic floor physical therapy does and what every woman should know and do about training their pelvic floor. My name is Denise Diener, and I'm here with my partner, Lena Lloyd. We are both physical therapists at St. Jude Centers for Rehabilitation and Wellness. And today I'm going to cover these topics. I'll introduce our team to you. We'll have a pop quiz on pelvic floor physical therapy. I'll explain the training and background of a pelvic health physical therapist and common conditions that are treated by pelvic floor physical therapy. And then Lena will take over and discuss in more detail what a person could expect by coming to see one of us for one of these conditions. And then we'll have time to finish with some common questions and answers concerning our therapy. So here's our team. There's 5 of us on the pelvic health team here at St. Jude Center for Rehab and Wellness, known as CRW. There's also a physical therapist assistant who has over 25 years of experience. That's Jill, the lady standing in the back with the pink top. And then we're also supported by Marissa, who's next to Jill. She's our clerical support member who would be the person you'd be speaking with when calling to schedule appointments with one of us for therapy. So let's begin by testing your knowledge on what pelvic health physical therapy is all about. To begin with, true or false, it's normal to leak urine when you cough or sneeze, or especially after having a baby. If you think about that, it's a fairly common problem, but the answer is actually false. It is not a normal finding. So what we would like you to consider, if this is your problem, that you seek some help so that you can overcome these problems. Next, what would you guess is the normal interval during the day to empty your bladder? So that's what voiding interval refers to. Looking at these answers, if you selected answer D, that was correct. Once per hour is considered too often. 20 minutes after drinking something is also not a common phenomenon, even though people do tell us that's their experience. If you're waiting longer than 4 hours to use the restroom, that might be an indication that either you are dehydrated and not getting sufficient fluid, or that you are retaining your fluid. And that is something that could be diagnosed with urodynamic studies. The next question, true or false? Physical therapists only work on large muscle groups or movement activities. Well, that's kind of a setup. That is actually false. Some of us specialize in pelvic health and pelvic floor muscle rehabilitation. And as you can imagine, that's a very small muscle group located at the bottom of your trunk. Next question, true or false? Physical therapists are trained to do pelvic exams. And that question is true. Pelvic health physical therapists are actually trained, and we've gone through some specialized postgraduate training to do pelvic muscle exams either vaginally or rectally. This is not common in your general physical therapist population. So if you've sought therapy through a different type of clinic, you would want to ask your therapist what specific training they have. So why see a physical therapist for some of these common concerns that women have? Seems a little shocking, I know, but the background of a pelvic health physical therapist is we all have our doctorate in physical therapy from an accredited university, and many of us have additional degrees in related fields of health and science or perhaps business administration. Our physical therapist assistants have also been specially trained to treat this population, and they function as a care extender, similar to how physicians and physicians' assistants work together in their clinics. All of us are specialists in movement science, and our main focus is to restore natural and pain-free movement. In addition to that specialized training, all of us are members of our professional association, the American Physical Therapy Association, and its Academy of Pelvic Health Physical Therapy. Some of us are board certified, have gone on to have specialized degrees in orthopedics or women's health. And some of us have specialized training through the Herman and Wallace company that offers pelvic health training. So why see a pelvic floor physical therapist? Could you benefit? If you've got some of these conditions, this is a short list of conditions that we treat for pelvic floor physical therapy. Urinary incontinence, fecal incontinence are probably by far the most common complaints that our patients have. But in addition to that, pelvic organ prolapse, gastrointestinal disorders such as irritable bowel syndrome or inflammatory bowel disorder, issues surrounding pregnancy, either in the peripartum or postpartum months, chronic pelvic pain, conditions such as interstitial cystitis, endometriosis, or perhaps abdominal pain related to scars or surgery or following cancer treatments. And then some of you may not be aware of this, but we also treat children and men for similar problems. What are some of the risk factors that set a person up for pelvic floor disorders? There are non-modifiable or things that you can't really do much about. Non-modifiable risk factors is what I meant to say. Related to pregnancy or delivery, trauma to the pelvis or the abdominal wall, abdominal and gynecological surgeries, and then the stage in life that you might be in, whether it's menopause or early on in life. Young and old could benefit from coming to see a pelvic health physical therapist. Some modifiable risk factors, however, that are related to developing a pelvic floor dysfunction could center around diet or exercise habits, weight management, some faulty toileting behaviors, and or bladder health and faulty dietary fluid intake, such as things that you would choose to drink that could irritate your system. Some of these problems are modifiable in the early stages, but later on transition into things that you can't do much about, such as a comorbid condition of diabetes, stroke, or cognitive impairment. So to talk more about these conditions, I'm going to change now and allow Lena to describe more about pelvic floor physical therapy.
My name is Lena Lloyd. And now that Denise has gone over who we are and what we treat, I'd really like to talk to you today about how we treat these conditions in pelvic floor physical therapy. And the answer really is that it depends, because everyone who comes here will have an individualized treatment plan that's based on your primary complaints, whatever your goals may be, the diagnosis that you've been sent with, and any other concerns your doctor would like us to address with you. So first, I'm going to discuss the most common problem we see, and those are problems associated with having a weak pelvic floor. And this looks like urinary incontinence, urinary urgency or frequency. It could be anal incontinence, and that could be to stool or gas. Pelvic organ prolapse, and that is the descent of your pelvic organs like your bladder or your uterus, or diastasis rectus abdominis, which is a separation of your abdominal muscles. So how we treat this condition is by focusing on specific exercises and muscle retraining to strengthen and coordinate your pelvic floor muscles. So biofeedback is a tool that we use that really allows the patient to see how well their muscles are responding in live time. I find it to be a very helpful training tool. Electric stimulation is something I reserve to use only when a patient really cannot get an active pelvic floor muscle contraction. We use bladder training techniques, especially for those that have overactive bladder, urinary urgency or frequency. Education in bowel, bladder, and sexual health is a big piece of what we treat here in pelvic rehab. And I would argue that the home program is the most important piece of pelvic therapy because it's not what we do with you once a week in the clinic, but what we can teach you to do every day at home that really drives the success of this program. And so once we get your muscles as strong as they can be, we'd like you to maintain that by transitioning you into a pelvic floor fitness and wellness program. So the second most common problem we see are problems associated with having a tight pelvic floor. Um, and so some people, for various reasons, have tight pelvic floor muscles, but it can also be due to post-surgical scarring. It can be due to birth trauma, cancer treatment, or other common pelvic conditions like endometriosis, interstitial cystitis, and IBS. And so for people that have pelvic floor muscle tightness, the treatment is really focused on pelvic floor relaxation. And your pelvic therapist will facilitate that by using soft tissue mobilization techniques and manual therapy. And that is generally internal and external treatment. They can do trigger point release, again, also internally or externally. They can recommend dietary and behavioral changes. What I find is that patients often have habits that they are not aware are contributing to their bowel or bladder symptoms. An example of this for a dietary recommendation would be to avoid certain bladder irritants for those that have bladder pain, urgency, or frequency. An example of a behavioral modification would be to avoid going to the bathroom just in case for those that have to go frequently during the day, or to avoid late night eating and drinking for those who have to go frequently overnight. And education in bowel, bladder, and sexual health in the home program continues to be a big part of your treatment for this problem. Before I move on, I do want to mention that in just a little bit, we're going to talk about how to strengthen your pelvic floor muscles. And for these folks who fall into this category of having any type of pelvic pain or pelvic floor tightness, we do not recommend you doing Kegel exercises, meaning that if we already have tight pelvic floor muscles, we do not want you doing exercises that would further tighten those muscles. Okay, so bladder control is a fitness issue. What we mean when we say that is that urinary incontinence is due to having insufficient strength or coordination of your pelvic muscles. So, an interesting fact is that at least a third of women tested could not perform a Kegel exercise correctly. And to really maximize the benefits of a Kegel exercise, you must exercise the right muscle. It has to be very specific. Okay, so how to perform Kegels properly. We'd like you to coordinate your breathing, and that means to gently exhale as you Kegel. So, the most common mistakes we see when women try to perform Kegels is that they hold their breath, they strain or bear down, or they try to suck up their pelvic muscle. And so the second thing we want you to think about is to really isolate your pelvic floor muscle. And that means not to squeeze your glute muscles, your thighs, or your abs. And for those who are just starting to perform Kegel exercises, they may find that they can only hold their Kegel for a couple seconds when they're starting out. But we want you to learn to hold for longer periods until you can get to 10 seconds consistently. Okay, and so before I talk about how to do a Kegel, I just want to clarify what a Kegel is. And so for those of you who may not know, a Kegel is simply a pelvic floor muscle contraction, meaning the movement that you would do in trying to stop your urine flow. So this was named after Dr. Andrew Kegel, who encouraged women to be doing these exercises some decades ago. Okay, so how to Kegel? I want you all to gently inhale and prepare to Kegel. And then as you gently exhale, I want you to think about Kegeling. And that means to stop your urine flow, trying to pull the labia together, trying to close through the vagina. If you were to perform this correctly while urinating, it would stop or slow your urine stream. And so we call that a stop test. It's okay to do a stop test periodically to make sure you can identify the correct muscles, but we certainly would not want you to do a stop test every day or every time you urinate. And so once you know how to do your Kegels correctly, we want you to work Kegels into your daily routine. I find it easiest to have a cue to remind me that it's time to do Kegels. That could be sitting at a red light, waiting in line or at the doctor's office, during commercial breaks at home when watching television. Ideally, we want you to work it into your exercise regimen. So if you already have a gym routine, if you're doing squats or lunges or abdominal exercises at home, find a way to work your Kegel exercises into the things you're already doing. Okay, and then we want you to aim for 30 to 50 repetitions a day. Pelvic floor rehab. It's a place to start if you have any of the conditions that we discussed today, if you're experiencing any pregnancy related back, pelvic, or perineal pain. I'd like to mention that a physician's order is required to begin pelvic rehab, and these services are covered by your insurance policy. In closing, what do we want you to do? We want you to pay attention to any changes you may have in your bowel, bladder, sexual function, or any discomfort you're having in the pelvic region. And please don't ignore the signs of pelvic dysfunction. We want you to work to keep your pelvic floor muscles strong as you age. So, just like any other muscle in your body, your pelvic muscle is going to tend to atrophy as you age unless you are actively working to keep it strong. And lastly, we want you to seek help if needed. Um, don't be afraid or embarrassed to speak to your doctor about this condition. It is very common. So, we want you to be open and honest in discussing this with your provider. How to contact us. We are located at the Centers for Rehab and Wellness in Brea, California. For those of you who are local, we're right in Imperial Highway between the Walmart and the Whole Foods. The phone number in front of you will take you directly to our scheduling gal, Marissa. She can also help answer your questions or forward your call to any one of us who can further answer your questions. Okay, so now we'd like to go over some common questions that we get. Okay, so the first question I have that we're commonly asked is, will I need to get undressed for my first visit? And the answer is, if you're comfortable with it, yes. If you're not and you like to defer that to your second or third visit, then that's fine too. We will do whatever you are comfortable with. I will say that it is important when you come to pelvic rehab that your physical therapist can really assess what it is that you're coming in for so that we know how to treat you. So at some point, we will need to do a pelvic exam. The second question I have is, can you help someone who has had their problem for several years? That to me is an easy answer. And the answer is yes. We see people that have had chronic conditions for a long time. I'm going to piggyback on that question because I often also hear, am I too old for you to fix this problem? And the answer is no. We see people of all ages. We've certainly been able to help lots of women in their 60s and 70s and 80s. But the answer is yes, we can see you even if you've had a chronic condition. It may take a little bit longer than someone who's had it for a shorter period of time, but we can certainly treat it. The third question I have is, what do I do if I'm on my period or if I have a bladder infection? We would certainly want you to do what's comfortable for you. So if you're not feeling well, certainly stay home if you had a bladder infection. With a bladder infection, we would certainly defer any internal treatment or exam. But there's no reason why we can't work externally. So if you still feel well enough to come in, come in. We're still happy to see you. And I would say on your period, absolutely come in. Many patients find that, especially if they're on the tail end of their period, it doesn't get in the way of all of what we need to do. And certainly we can always work externally. And there's things that we can do that won't require any type of pelvic assessment internally that day.
Okay, so one of the questions that we get sometimes is, I'm currently undergoing radiation and or chemotherapy for cancer treatment. Can you still help me now, or do I need to wait until after I'm finished with those cancer treatments? And the answer, of course, is it will depend. But some people that are really suffering the side effects of those types of treatments might be better off waiting until they've concluded with their cancer treatment before they initiate pelvic floor physical therapy. Others are on a more long-term treatment plan for that cancer diagnosis, and they might as well go ahead and work with us right along. The next question that we sometimes get is, I just had a baby. Do I have to wait until my 6-week OBGYN checkup before I can get started with pelvic floor physical therapy? And I would like to say that I want you to come as soon as you feel like you're comfortable coming. Many women experience some of the conditions we just talked about, such as urinary incontinence, right away. And waiting until your 6-week checkup might be just a little too long to be putting up with that nuisance. So the doctors are sometimes reluctant to have you start therapy any sooner than that, but you can get a doctor's clearance to come earlier, and we would just follow the doctor's guidelines as to what you can and cannot do while you're in therapy. But we could definitely help a woman who's experiencing these problems as soon as she's capable. And then finally, a question that I get is, can I bring a partner or a companion to my appointment? And yes, while we are still following the guidelines for distancing and COVID restrictions, many women just feel comfortable having a second person in the room when they're working with one of us. So I encourage you to do whatever is necessary for you to feel comfortable having this type of a problem addressed. Thanks everyone for attending and watching our presentation on pelvic health physical therapy, what every woman needs to know and do. We're glad you came to hear our talk.